so that we can invite His Excellency the President to make his remarks. Asante sana na makofi kidogo.
Asante sana, Prime Cabinet Secretary. We may take our seats. Thank you. Mr. Prime Cabinet Secretary Musalia Mudavadi, our Chief Justice and President of the Supreme Court, Madam Martha Koome, the Chairperson of this great institution, Professor Mugenda, CSS President, Permanent Secretaries, the CEO of this great institution, Professor from the Vice Chancellor of Kenyatta University, members of Parliament present here, led by the Chair of the Health Committee in Parliament and a Member of Parliament for this constituency, professionals present here, ladies and gentlemen, good afternoon. Hamjambo. I believe all of us here have been brought together by this very important event, primarily because of our commitment to provide healthcare services that will enable the people of Kenya enjoy the highest attainable standards of health. This constitutional mandate bestowed on us by the Constitution challenges us to find ways of developing an accessible, affordable, and effective national healthcare system that delivers the best preventive as well as curative services. As government, we have made a commitment to the people of Kenya that we shall harness the post-pandemic recovery momentum to make significant progress in reversing and minimizing the burden of non-communicable diseases, especially cancer, heart diseases, and diabetes-related complications. Additionally, we are acutely aware of the drastic socioeconomic impact of these diseases. Many Kenyan households live under the threat of having all their savings wiped out by illness, and 36% of Kenyans risk falling into poverty on account of catastrophic financial expenditure. Our commitment under the universal health coverage pillar of our bottom-up economic transformation agenda consists of a well-considered intervention to ensure that we fulfill our obligation to deliver the best possible level of medical treatment and healthcare services affordably, efficiently, and in an inclusive manner. As has been articulated by CS for Health, I have taken long hours, many hours, with my team at the Health Department to figure out how we are going to do this together with our counties to ensure that this time round we get it right. We have attempted universal health coverage twice, and we have not succeeded. I have told my team this time there is no chance for us to fail. We do not have the luxury to fail. And that is why we are having a paradigm shift on matters health. While we support the entire ecosystem of curative health, we have to reimagine and focus our attention this time round on preventive and promotive interventions as a way of minimizing cost and arresting situations at the earliest possible opportunity. To succeed in this commitment, we are deeply conscious of the fact that health is a devolved function, requiring us to employ consultative and collaborative mechanisms of intergovernmental cooperation and partnership with due regard to the evolving role of donors and other stakeholders. Access and quality are the most salient concerns in considering the ways and means of delivering health care to Kenyans. For this reason, it is extremely important for us to sustain the momentum in which we have expanded the infrastructure to house various categories of health facilities and equip them with the equipment and technologies required. It is also important to accompany this development program with interventions to radically bring down the cost of treatment to a level where it is no longer a barrier to access for the majority of Kenyans. And I agree with the comments made by the chair of this great institution that we have waiting lists running into months for access to chemotherapy, for access to linear machines in our various institutions. At the moment, we only have 3 linear machines in public hospitals, 1 in this great institution, 1 in Kenyatta, and 1 in Moi Teaching and Referral Hospital. I want to say that going into the future, I have also received requests for a linear machine in Nakuru, Mombasa, and Garissa. And now I have also gotten a request that you have an extra bunker in this facility. I want to commit to you, as I do to the other 3 hospitals in Nakuru, Mombasa, and Garissa, that these LINAC machines will be delivered in the next 120 days. The Ministry of Health is properly guided on the mechanism for the delivery of these machines, and I agree that we should reduce the time Kenyans have to wait for treatment from months to days. Hopefully, with the delivery of these 3 machines, Kenyans will have to wait for hours. Hopefully. I am really hoping that that is the direction we want us to go. Any additional equipment that will be required, we are going to have a conversation. We have already agreed with the ministry on how we are going to deliver on the critical equipment that are required for the proper functioning of our health facilities across the country in a manner that is cost-effective, in a manner that does not put costs ahead of service, in a manner that we have clarity. The cardinal plank of the government's commitment, therefore, include the reform of the National Hospital Insurance Fund to become a social health insurance scheme that can support universal health coverage and expand its operational capacity. And again, let me say that we have taken time. We have interrogated the new National Health Insurance Scheme legislation. We have gone through the regulations that were taken to court by some of our partners, and we have agreed, in fact, with some of the proposals of our partners, that there is no need for matching of our contributions on health, and therefore we will be presenting, we have 2 final meetings with my team, and then we will be presenting the regulations and the new amendments to the law to Parliament, hopefully by 15th, I think, Susan, by 15th of this May, so that again you can interrogate the regulations and give us the legal and operational framework for us to deliver universal health coverage. This time, I have said, failure is not an option. Today, and I'm happy that members of the Committee on Health are here. we have taken long hours, and we will shortly, by the 15th, I think we have the final meeting on the 11th. By the 15th, you will get regulations, the new regulations, the ones that were challenged in court. We have looked at the issues that were raised, and we have agreed with some of them so that we can fast track the delivery of universal health, because it is a commitment we made to the people of Kenya, and it is a worthwhile commitment because health is a very critical aspect of public goods that the Constitution demands of us to deliver to the people of Kenya. Further, we are committed to integrating preventive and promotive health into the universal health care coverage. Beyond this, it is our intention to build a transparent and efficient supply chain management system integrated with ICT in medical services to promote telemedicine and establish health management information systems. Again, on this aspect, we are in discussion with many partners to help us deliver on this very critical aspect of using technology, using ICT to make health services easily affordable and accessible. I was very happy when I went through the facilities in this hospital that a professional was responding to questions. A professional, I think she was in Nyandarua. She was in Nyandarua, was actually addressing the needs and assisting in diagnosing what was going on here in Kenyatta. That is what technology can bring. It can reduce the distance. It can make many more doctors, many more professionals available on technology, online, using the digital platform so that we can better serve and better dispense health products. Let me also say this event is therefore a true milestone in our national healthcare journey because we are here to launch a center which represents the convergence of high standards of treatment, state-of-the-art technology, affordability, and effectiveness in cancer treatment. And I can testify the way Chief Justice has that indeed the facilities here are world-class. At this center, which is equipped with a broad variety of sophisticated diagnostic imaging technologies, Kenyatta University Teaching, Research, and Referral Hospital will deploy an advanced robotic radiation treatment machine known as the Cyberknife, which introduces revolutionary capabilities and enhanced efficacy in cancer treatment by locating, tracking, and accessing tumors that are ordinarily difficult to reach with precision. Again, I agree. Now we will move to Cyberknife precision. The technology is therefore able to administer more radiation with great precision, meaning that fewer sessions, maybe 4 to 5 only, instead of 20 to 30, are required, with each session lasting only between 5 and 15 minutes. This will significantly improve treatment outcomes and be able to deliver these services better, affordably, and much more effectively. Cumulatively, these advantages lead to shorter recovery period, minimal side effects, and better overall outcomes. The government therefore intends to sustain its investment and support for highly advanced diagnostic and treatment equipment to actualize the highest standard of treatment and care for all people. The Cyberknife technology at this hospital is the second in our continent, the only other being in Egypt. This propels Kenya to the frontier of advanced medical technologies and catalyzes our strategy to quickly emerge as an advanced regional and international medical hub. Its location is in a public hospital sends a strong signal to all Kenyans that it is no longer necessary to travel far away for advanced treatment that are now available, accessible, and affordable in our public hospitals. Kenyans who are already covered under the NHIF can receive radiation therapy without paying any top-ups. And I was pleasantly surprised that at every turn in this hospital, I was told the services available here are paid for by NHIF. And it gives me the inspiration to reform the NHIF and make it good and fit for purpose. Medical professionals trained in Kenya remain globally acclaimed. Our medical facilities, including infrastructure, equipment, and technologies, are undergoing a drastic transformation on account of immense public, private, and not-for-profit investment. The case for traveling out of the country for medical attention is weakening by the day, while that for receiving treatment locally is now much more compelling. The hospital's diagnostic imaging facilities have processed more than 6,000 patients since they came into operation. This has saved Kenya and Kenyan families more than Kenya shillings 10 billion. To maximize the clear possibilities presented by this facility, we shall collaborate with the county governments and mobilize necessary investment to modernize health facilities, health promoters initiative, where for the first time we are going to equip them appropriately. And the government of Kenya, through the Ministry of Health, is working on the equipment to equip 100,000 community health promoters. And we are also going to work with them on their stipends so that every community health promoter in every locality will be responsible for 100 families. And it will be a requirement that every community health promoter, at least once in a month, they must visit every family, so that we begin the journey to diagnose, we begin the journey to understand the health of our communities, and also prevent unnecessary expenditure on illnesses that can be managed if they were discovered early. We are also working on how to reform the entire chain so that we can also devolve resources, devolve decision-making, and also bring on board all the partners that we have. All our procurement facilities, as I have said here, apart from technology, we are also going to bring on board other stakeholders. We're going to bring on board those partners who help us with the delivery of health, whether they be non-governmental organizations, private hospitals, public themselves to participate. And we have agreed with the counties that they are now working with us on the 315 community primary care networks, 315 primary care networks that are that actually cover every part of Kenya to ensure that we keep tabs on matters health as close to the citizen as is possible, and that decisions will be made at that level on procurement, on service delivery, and we can also give an account of what health looks like in every locality. To further enhance access and affordability of health care, government is committed to promoting investment in local manufacturing of pharmaceutical and non-pharmaceutical medical supplies. Our domestic market for pharmaceuticals and medical consumables is a whopping 110 billion Kenya shillings, of which less than 20% is locally manufactured. There is an immense opportunity for investment in manufacturing, and the government of Kenya is going to take all necessary measures to guarantee a business environment to make Kenya the region's pharmaceutical manufacturing hub, both for manufacturing for our local consumption and also for our region. After seeing what Kenyatta University Teaching, Research and Referral Hospital has achieved in establishing a modern center to provide advanced diagnosis and treatment, I am persuaded that it deserves support to complete the stalled Children's Hospital and Pediatric Cancer Wing, and also to construct a women's hospital with a breast cancer center. We are going to work out the details on what that looks like, and we are going to work together to ensure that it is delivered in a timely and, much more importantly, cost-effective manner. We are keen to develop a network of specialized public referral institutions providing advanced care that is driven by scientific research and technological innovation. And again, I want to include the items that were, and I have already told Waziri to look into the next generation sequencing machine so that, and see what we can do in ensuring that we can deliver that facility. Hopefully, we can be able to assess and we can be able to do what that machine is doing elsewhere, but back here in Kenya. So we will work with you. We will work with all the other stakeholders that support this hospital. And I want to thank our good friends from the World Health Organization for their partnership in the delivery of this facility and in what they are doing with us. Again, to commend you for the MOU that was signed this morning between WHO and our Ministry of our Ministry of Health, so that Kenya can be positioned, or we can position ourselves as a country, as a hub. I have already instructed Moses Kuria to provide the 50 acres for you in Mombasa, and he is already working on the details, and I have his commitment that that will be ready in a month's time, and therefore the ball will squarely be in your court thereafter. To strengthen our partnerships with key global institutions for the benefit of the people of Kenya, I am delighted by the decision to make available 30 acres, as has been mentioned, of unutilized land to the World Health Organization for the development of a regional health emergency hub and training center for Africa. I note that this provision leaves adequate land available for the future expansion of the university and this hospital. The MOU signed today provides a framework under which Kenya and WHO will collaborate in health, training, and rescue efforts during disaster and other emergencies. Other benefits expected to accrue from this collaboration will include employment opportunities as well as capacity building and technology transfer. I know Mr. Kamande, the Member of Parliament for this area, will be asking me many questions later. I want to promise you, Mr. Kamande, and the people of your constituency, that the Kamai issue will equally be sorted out. And when I say the Kamai issue, it will only be the Kamai issue. I know that there are other pretenders who want to say they are squatters. We are only going to sort out the squatters in Kamai. The other people who drive big SUVs and want to pretend to be squatters, they will have no chance. Because I think I congratulate Kenyatta University Teaching, Referral, and Research Hospital for this historic milestone, which is also a wonderful medical and technological investment. It is a bold statement of intent which emphasizes Kenya's resolve to become a regionally and internationally competitive healthcare investment destination, medical services, and pharmaceutical hub. Let me also say to all the staff and management of this great institution, my congratulations for the wonderful job you're doing. I was able to witness firsthand the incredible job you're doing in serving the people of Kenya and humanity. And I commend you that our very best wishes as you do this for our country, for our people, and for humanity. I now, ladies and gentlemen, take this opportunity again to congratulate all of you, especially the people who have made this a reality. I remember having a conversation when I was Minister for Higher Education once upon a time. I was having a conversation with Professor Mugenda when she was Vice Chancellor of Kenyatta University about this institution. I am very proud today that I have come to be part of the success of this great facility. Ladies and gentlemen, I now declare the Kenyatta University Teaching, Research and Referral and Hospitals Cyberknife Center officially commissioned, and my very best wishes as you make use of this modern facility. Asanteni sana. Thank you very much, and may the good Lord bless you.
Tumpongeze Rais tena kwa makofi kwa hotuba yake iliyo bora. Asante sana Mheshimiwa Rais. And just 2 items.